Hi, I'm Roni, one of the physical therapists here at Hope Physical Therapy and Wellness, and today I want to do a little video talking about the autonomic nervous system and what role that plays, particularly with people with chronic pain. So the autonomic nervous system runs our organs, how fast our heart beats, how quickly we're breathing. We have some control over it, but not full control like we do with the motor system that makes me bring food to my face or do different activities. So the autonomic nervous system has two main parts, the sympathetic and the parasympathetic nervous system. So the sympathetic nervous system is known as fight or flight. So if you're running from a bear, it primes the body to be able to survive that encounter. So either running away, climbing a tree, it just sends all the blood, not all the blood, but more blood to the muscles and increases heart rate, increases breathing, helps focus the vision, figure out how do I get out of this situation. It decreases blood flow to the intestines, gastrointestinal system, and it can, on occasion, particularly with chronic pain, go into a bit of overdrive, and it's called sympathetic upregulation. And so that nervous system is primed for use, but there's no bears to run from, and that becomes a problem because the body then is interpreting, the information that it's getting wrong. So that brings us to the parasympathetic, and how can PT help with getting that parasympathetic boosted and calming down the sympathetic nervous system? So the parasympathetic is rest and digest system. If the sympathetic is fight or flight, holy cow. So I'm upregulated right now making this video because I don't really love being on the camera. So anyhow, so the parasympathetic is rest and digest. So the main nerve that works with the cranial or the parasympathetic nervous system is the vagus nerve. It's the 10th cranial nerve. It starts out in your brainstem, and vagus means wandering in Latin, and it wanders all the way down into the gastrointestinal system. So it's the longest of the cranial nerves, and it plays a major role in helping with parasympathetic stimulation. So if you're upregulated with the sympathetic nervous system, we have ways that we can interact with the vagus nerve to help stimulate that parasympathetic side, which decreases anxiety, improves digestion, decreases heart rate, so all the opposite of that survival mode. So one way we can do it is with breathing. Breathing techniques help with the diaphragmatic breathing, which we have some videos on that on the website. But the other way we have that's new and here in the clinic is with the dolphins. So let me carefully take this off. So this is a Micro Point Stim, also known as dolphins because of the noise it makes. You might have heard this in the clinic if you're a patient. But the Micro Point Stim use micro amperage of electric stimulation. So there are some contraindications. Talk to your therapist about that before we hook you up. But they have this little adapter that they've done, and it then can connect through this black wire to an ear clip, to a clip that we can put on your ear. So we have access best to the vagus nerve through here. So that clips on your ear or your tragus if you have a big enough tragus, but I don't have a very big tragus, so I can't get mine on there. And then it has a grounding pad that for most people will be placed below the belly button to kind of get that full length of the vagus nerve stimulated. And then we'll turn this on, and then once we know we have a good connection, we turn off the noise and have people try this, sometimes with some heat or ice if something like that would be beneficial to you. But we've had some really great results with, number one, being pain decrease. So when you are in a sympathetic upregulated state, that increases muscle tightness and helping to calm that down, helps decrease pain, helps decrease anxiety. And I had one patient that I hook her up immediately, and she's like, oh, I feel better. So if you think this would be something you might be interested in trying, please give us a call here at Hope, and we'd love to talk to you about it and see if this is something that might help. There's some really great articles out there. If you're interested in Googling it, you can look up Vagus, V-A-G-U-S, nerve stimulation with chronic pain, with fibromyalgia, and there's some things you can check out there. If you have any questions, please contact us here, and we look forward to helping you out. Thanks.